Good evening, everyone. Welcome back. We hope you're having a great Thursday. We are so happy you're joining us for a very important show tonight. This show is about really anyone you know, maybe someone, whether it's you, a loved one, that's dealing with addiction or a mental illness. It's a very serious topic, but there's help out there, and that's what this show is all about tonight. We're here tonight with the folks at Foundations Recovery Network. We have Jeremy Pitzer, he's the CEO, and Dr. Lucas Trautman, Medical Director for the Oaks. And you guys have been giving us some great advice tonight. We've had some calls coming in, and even just kind of sharing about some of our just personal opinions. You know, obviously it's something that it takes a lot of courage when you're ready to get help. Walk us through what exactly will take place when you finally make that phone call. Can you give us just an idea?
You're going to get a lot of support. Probably the most uncomfortable piece is it's, you know, once you commit, there's a lot of questions. It's going to feel like for several days, you know, through the call and then after admission that you're being asked a million questions, and you are, and that's to help us help you figure out the best way to approach treatment. So, but I think you'll find with our team and our staffs that they're probably the most caring, most compassionate, most supportive, most knowledgeable people that are going to guide you through that process, whether it's for you or a family member. They're really committed to seeing that through, and they do this really cool thing where they, once somebody does commit to treatment, they follow up with a card, you know, a handwritten card. I don't know what they say. I'm assuming they're positive, but because the patients really respond well to that, and so they're just committed to seeing it through.
And Dr. Trautman, they walk into your office. What takes place?
Yes, so the medical staff, it's me and the psychiatric nurse practitioners. We have a team that we meet them for initial evaluation, where we get to know them. We learn their medical history, the medications they're on, their whole past treatment history, and we come up with a medical plan and a psychiatric care plan for them that integrates with the treatment team. So we get a big treatment team with the clinical director and the therapist and all different types of clinical staff, including the medical staff, the nursing staff, to where we're all on the same page. Once a week we get together, we discuss every patient, and we get together with that patient and we meet them where they're at and develop a psychiatric plan for them. We're sort of their medical liaison through the whole process.
Wonderful. You know, I want to ask, say we have someone tuning in tonight, we very well might, that just they're just afraid to make that call. No matter what we say this evening, they're still not quite to that level. While I have you both here tonight, what would you want to say to somebody?
Call. You can never have that conversation too many times. Call for help. Get guidance on how to approach it. Whether it's for you or somebody else, you can never reach out too much.
And this
well said.
Well said, and this is what we do, and we're passionate about it, and we're educated, and we all have our areas of specialty. We're eager to take care of people. So if they call, they're going to come to a supportive, patient-centered staff who's ready to help them meet their goals.
You know, I feel like, and correct me if I'm wrong, is there a little bit of a stigma towards not just mental health conditions, especially when dealing with depression and anxiety, towards men? It's sometimes that, is there kind of a common occurrence there? A lot of men worried to get the help because they feel like, you know, that's something that we don't talk about, or back to that stigma question we talked about earlier tonight, and I'm just asking. Yeah,
and I think he kind of touched on it earlier too when he was talking about self-care for providers. It's kind of that same mentality of pull yourself up by your bootstraps, and you know, that doesn't always work. You can't just suck it up and the depression goes away. And so yeah, I think there's absolutely a stigma there, more on the depression side or the mental health side. You know, it's okay if, you know, somebody has an addiction, but yeah,
absolutely. I mean, we are taught as young boys that we're to be tough and be the providers, and a lot of times that doesn't lend itself to seeking help. But I think it's a very strong thing for a family member to do, to seek help. I used to live in Hawaii and work near Schofield Barracks with the Army, and I was a civilian contracting with them, and I saw a lot of people coming back from recent deployments, some of the strongest people that I've ever met, and their families were strong. And a lot of the men coming back were at first resistant to seeking treatment, but watching them go through it, watching the courage of them, the strongest people who had been fighting for 13 months on the front lines, come back and seek help, I saw that as an act of strength for the family. And so yeah, that stigma for men does exist, and and it can be overcome.
Yeah, a different but equal kind of bravery in a way.
Yeah.
Well, let me ask you too while I have you tonight, maybe a concern from folks. I'll ask the questions for people tonight. I think we've had these questions come in, so I'm kind of bringing them back up. I remember from past shows with you all, someone once called in and they mentioned that, what if you're afraid you have a very demanding job that you can't feel like you can walk away from, but you really do need to seek some help? What can you do when you're in that situation?
Yeah, there are options. Even within our network, we have intensive outpatient programs that are in the evening. So if it's really where somebody cannot possibly disrupt their job, there's something for that at our locations. But also, people tend to doubt their employer, and some of it's real and some of it's sort of perceived. There may be resources available through their HR department. Their boss may be more caring and flexible than they think. So a lot of there's that sort of that fear and stigma associated with that. So yeah. There's ways to do it.
We've seen people, unfortunately, sadly, complete suicide, and we hear the boss say, "I wish they'd have told me. I wish they'd have told me, because I would have been there for them if I knew they were suffering, if I knew they had such severe depression. I wish I had that chance." And so it's my experience with employers the same way, that the employers give them a chance, because they probably will. There's a good chance they would be more supportive than you'd think when faced with a crisis.
Yeah.
You know, Jeremy, CEO at the Oaks, what are you most proud of? Sorry to put you on the spot, but you know, obviously it's a topic that you are all passionate about. It's your, it's your field of expertise. Being the CEO, I want to hear.
I am so proud to have such an amazing team to work with. I have the most caring, competent people. I can't say it enough. I work for this first-class organization that really values the work we do. It's not about money, or it's 100% about the people we work with, and we have the best people. So.
And same question for you as medical director.
100%. Walking the halls and giving high fives to the chef, to the different therapists that work there, the cohesiveness and the morale of the staff and the passion of the staff and the clinical competence of the staff, and Jeremy's leadership to help facilitate that culture and really build it up and solidify it. That's far and away our strength.
Well,
it's the team.
Yeah,
it's definitely. The team. We have the best team.
I can tell that. I want to go ahead and address some of those events that we discussed earlier in the show tonight. Again, 2 events that are coming up we really want you to know about. The first one's Innovations in Behavioral Healthcare Conference, and that's coming up in August. You're going to want to check that out. Finding information if they need it. Where can we go? Probably online.
Foundations Recovery
Network. Just go online to Foundations Recovery Network. You can find most of the information you need from tonight's show by heading online. Also, the Heroes 6K Run Walk. That's coming up. That'll be in Nolensville in September, and that sounds like just 2 really exciting and yet helpful events. I'm sure you're looking forward to those.
It's really fun. It's really fun. We have great swag. Everybody has fun. Dogs are welcome.
Oh wow, that's great.
It's a really cool run walk. Yeah.
Yeah, I think it's really good to get out in the community too, kind of meet some other people that are maybe sharing that struggle, and you know that there is a community there as well.
That's such an empowering thing, to meet other people who are in that as well, and not knowing it and finding that solidarity. It's amazing.
Let's go ahead and get the information back up on the screen, if that's okay. We have a graphic where if you need to just reach out, Foundations Recovery Network right there, free and completely confidential assessment, and that is 24/7, you guys. 615-371-4091. You can also visit the web, frnhelp.com, and we completely understand. Maybe you didn't want to call in tonight. Perfectly fine. Call that number instead. They are very happy to talk with you, and of course, I encouraged earlier tonight to visit these websites. I really enjoyed kind of viewing the Oaks. It was a beautiful facility there. Definitely something you all are proud of. Some videos on YouTube as well. There is plenty of places to get the information you need. It's just right out there. You just have to look or ask. And we appreciate you calling in tonight with those questions. We're going to take one final quick break, but keep it right here. News Channel 5 Plus.